Well, the FDA says it cannot find evidence that certain type 2 diabetes drugs like Ozempic can cause suicidal thoughts. Regulators reviewed reports claiming the drugs cause those effects in the FDA adverse event reporting system. However, regulators did note the FDA is not definitely ruling out a relationship, so they will continue to study the issue. Ozempic and similar drugs are gaining popularity as weight loss drugs. For a closer look at these weight loss drugs, we're joined by Dr. Chioma Okafor-Mbah. She's the owner and founder of Weight Loss MD and a board-certified family medicine and obesity physician. Thank you so much for joining us to discuss this. So I want to give people a baseline here. Will you start with how these drugs work and how they're different from other weight loss drugs or supplements that people can get?
Sure. Thank you for having me. So these weight loss drugs are different from some of the other drugs that we've had in the past. They fall under a category of drugs called GLP-1 receptor agonists, and we have been using these drugs for quite some time already for diabetes and diabetes management. The way these drugs work is that they regulate your appetite as well as they regulate your appetite in your brain and they regulate your food intake. They also work in your gut by telling you that you are full faster and by also slowing down the movement of food from your stomach into your intestine. This process is called gastric emptying. And so by slowing down that process, we are also feeling full much faster and thus taking less food in.
Really interesting, but not everyone can take these drugs. Will you tell us who is eligible and who really can't take these?
Yeah. So these drugs ideally should be used by people who are trying to manage overweight or obesity. So this is a drug that we would recommend for patients who fall under a BMI cutoff of 27 and above with one weight-related condition such as high blood pressure or diabetes or high cholesterol, or if they have a BMI of 30 and above, then they don't really need to meet these criteria. Also, if you have certain medical conditions such as medullary thyroid cancer or a specific type of familial cancers, either you or a family member called MEN type 2, you would not be a candidate for these medications. Pregnant women and people who are breastfeeding, and also certain people who might have acute pancreatitis or gallbladder issues would also not be ideal candidates for these medications.
And these haven't been, popularly talked about for a while. Is there enough information out there? Have we had enough time to know all the side effects yet? And will you talk about the ones that we do know about?
So these medications have been available since about 2005. And as a primary care doctor, I was working with these medications way back when, mostly for diabetes. Now we're using them in the realm of weight loss, and we are definitely learning a lot more about the side effects just because there's a lot more people and we're using it in different population people who don't necessarily have diabetes. The side effects are mostly gastrointestinal, which include nausea, vomiting in some cases. Constipation is a common side effect. We can also see gassiness or burping, acid reflux, some abdominal distension. Some people might feel fatigued and other people might actually have headaches. A lot of these side effects are short-lived, meaning that they happen when you start the medication and you will tend to get less side effects over time. They can vary also depending on when we increase the medications. So it is very important to take these medications under the supervision of a physician and to not increase it until you are actually ready to go up on the dose.
Yeah, absolutely. A lot to consider. A lot of conversations need to be had with people's physicians. Dr. Chioma Okafor-Mbah, owner and founder of Weight Loss MD. Thank you for your information and insight. We appreciate it.
Thank you.